My name is Kristen Lusk, and I am considering the facts for both sides of the case. The thing that stood out to me the most about this case was how the dentist office flagged their folders indicating which patients had HIV or AIDS. Um, the, the patient or the plaintiff clearly felt like her privacy was exposed, that her private information was made known to the public or to other people. When I was considering the facts for both sides, I found a source saying that it is believed in some places that employee safety is more important than patient confidentiality. Especially because people are putting themselves in harm's way in order to help other people. I think, yes, that it is more important in some cases for employees to have the safety that they need to keep themselves from being exposed to things that other people may have, like in this case, AIDS or HIV. Let's see. It's kind of a tough situation to think on because I would not want my private information being put out there. So I understand that having the red flags on the folders, that does look like something isn't quite right. But the only way anyone would know is if somebody made it public. And I don't think that that was the case. I did find a source that said, I'll read it here. It is the duty to maintain patient confidentiality and is an ethical and legal priority for all health professionals. I agree with that. I think that the patient had every right to have her information not be known, even to other employees who don't necessarily need to know her situation. With red flags having the words AIDS or HIV on them, that indicates to those people who have access to that folder that this person has AIDS. I actually spoke to the girls in the doctor's office that I work at today about the procedures, how this office handles this type of situation. Do they indicate on the folders which patients have AIDS or HIV? My doctor's office does not do anything like that. Because it is a small office, the doctor pretty much knows everyone who comes in. The physician's assistant, she is aware of patients who also have this type of situation. So it is not put in the records like the red flags indicating who has them, except where it needs to be said specifically. So just anyone in the office is not able to know who has AIDS or HIV by simply looking on the outside of the folders. One of the girls did say, however, that at another doctor's office that she worked at, they would use gold stars in the corners of the folders on the inside. Whenever the folders were first opened, part of the folders would stick out and a gold star would be there so that they could see. However, if the folders were closed, put away, no one would know which person had AIDS or HIV just by looking on the outside of their folder. I think that way of handling patient confidentiality is much better than using red flags with the words AIDS or HIV on it. So I do think that the dentist office is guilty of how they tried to indicate the patients who had AIDS or HIV, but I don't think that they are guilty of breaking patient confidentiality. One source that I found said that most healthcare professionals believe that they are at risk of acquiring HIV through exposure at their jobs. So to take extra precaution and making it known to those who need to know, I think is important to do. I don't think that it was necessary for every individual within that office to know if a person had AIDS or HIV. So I think that the dentist's office, how they handled the situation is wrong. But they believed that they were doing what they needed to do to protect their employees. Being that I could be exposed, I'm an allergy technician, and I handle needles daily by giving injections to patients. I don't want the worry of, oh, I got pricked by this person's needle, I'm going to have AIDS. I don't want that worry. It's not necessary. It would be nice to know which patients have that. We do actually ask that question when we first have that meeting, that consultation with patients. So I think that it is necessary for some to know, but I disagree with the red flags. I disagree with the word AIDS on the flags. I don't think that it was more than, I don't think that it was so much that the plaintiff should win this case. I don't think that it was a breach of confidentiality to that point. I think that the staff felt they had the need to know which patients had AIDS or HIV in order to protect themselves. So I am enrolling for the defendant.